Linear IgA bullous dermatosis. Definition: Linear IgA bullous disease is an autoimmune bullous disease in which blisters form of the skin and mucous membranes.
Chika Ohata, Associate Professor in the Department of Dermatology at Kurume University School of Medicine. Our department has performed substantial research on autoimmune bullous diseases for over 15 years. I was the principal investigator for the study on linear IgA bullous dermatosis, LABD, without linear immunoglobulin deposition other than IgA at the basement membrane zone in direct immunofluorescence. We did the study because we noticed that LABD lacks common diagnostic criteria. In fact, some investigators believe that exclusive linear IgA deposition with no other immunoglobulins or complement deposition at BMZ in DIF is mandatory, whereas others believe that concurrent weak IgG deposition at BMZ in DIF can occur. However, in the latter scenario, patients may be diagnosed with bullous pemphigoid, linear IgA-IgG bullous dermatosis, or epidermolysis bullosa acquisita.
Application in nursing. Linear IgA bullous disease usually arises spontaneously but can be triggered by an infection or medication. Most patients with linear IgA bullous dermatosis improve or disappear with Dapsone 50 and 100 mg daily. Pros and cons. The mucous membranes are affected in almost 19% of cases. Painful erosions appear because the blisters break. The most affected are the oral, nasal, and conjunctiva, which can cause scarring and synecdoche, and when they concern the cornea, they can cause decreased visual acuity and even blindness. You can take over other mucosa, but less frequently, such as pharynx, larynx, rectum, and esophagus. Issue applied to Ecuador. An 72-year-old man developed dense blisters that affected 60% to 70% of the body surface, including the torso, lower abdomen, and back, and extremities. The biopsy showed subdermal bullous dermatosis with neutropils and eosinophils consistent with idiopathic immunoglobulin A, idiopathic bullous dermatosis.
Bullous dermatosis. It is one of the subepidermal vesiculation, and we may see neutrophils as the main inflammatory cells. And there is sometimes a scattered eosinophils and perivascular lymphocytic infiltrate. Direct immunofluorescence will show their linear deposition, which is the most important thing here, is the linear deposition of IgA at the dermoepidermal junction, and that is usually 80% of the time. So linear IgA is heterogeneous subepidermal vesicular disorder. In children, the disease is referred as chronic bullous dermatosis of childhood, and both disorders caused by autoantibodies against the protein 97-120 kilodalton as degradation product of bullous pemphigoid antigen 2. Classic disease results in a group of annular lesions with thin spaldy, it's also important, and as we call it, string of pearls. Drug-induced cases have been described using vancomycin. So
Conclusion: Linear IgA bullous disease affects adults of all ages, but is more common in all ages, while childhood IgA dermatosis is disease of very low incidence in the international scientific community.
name's Ian McComb. I thought what we'd do tonight is have a little look at some of the cases of linear IgA disease that are in Global Skin Atlas. And we'll also look at a little bit at histopath and treatment. The thing that's important about this condition is that there are two separate age groups in which it can occur. There's this case here that occurs in childhood, called chronic bullous disease of childhood, and the more typical adult linear IgA disease. Now, we'll look at some of these images here first. This was a lady who presented with some blisters and excoriated areas on her buttocks. You can see some of the blisters still out here, these areas of excoriation. Now, she was initially diagnosed with bullous pemphigoid, and she had been treated with high-dose steroids for many years without really good control. The question as to whether she had had a biopsy done before, she probably had, and it was probably just an ordinary H&E biopsy, and immunofluorescence probably wasn't done, because when we saw her later, we did do another biopsy and direct immunofluorescence, and it showed IgA in a linear pattern on the basement membrane, and not the IgG and C3 that you would see in bullous pemphigoid. Let's just have a